2 years ago, a multi-million-dollar settlement was reached with an outpatient surgery clinic accused of malpractice in the death of Joan Rivers. The 81-year-old comedian died in 2014 after she stopped breathing during a relatively routine throat procedure.
A recent joint investigation by USA Today Network and Kaiser Health News revealed dangerous conditions that led to 260 patients who died during or after procedures at surgery centers. So what are the risks that you should know about non-hospital facilities? Alice Benjamin is an emergency room nurse and clinical nurse specialist. Good morning to you.
Good morning.
So what is a surgery center? And what would the main reason be that someone would choose to have a procedure done there as opposed to a hospital?
So a surgery center is the same as an ambulatory surgery center. And what they are is they're standalone facilities. They're not associated with a hospital. And you could have common surgical procedures done there. Tonsillectomies, colonoscopies, some minor procedures. And actually the number of surgery centers outnumber hospitals. But you have to be careful because they're nothing the same. And they're thought to be a convenient alternative to a busy hospital and also at a lower cost to the patient.
Jessica mentioned this joint investigation, this report. What were the procedures that led to the fatalities for adults and children?
Right. So in this investigation, they saw over 260 preventable incidents that led to patient death either during a procedure or after a procedure. And again, these were for common procedures. Again, colonoscopy, getting your tonsils removed, spinal surgery, joint surgery. Now, the surgeries themselves very simple. However, it's more so probably patient selection.
Okay.
People who have their surgeries at outpatient surgery centers are typically healthier than those who have them in the hospital. At least that's the selection criteria. But there were some other things in the report, including, improperly staffed with trained people there. The equipment was not out of date. And then also they were sending patients home too early after the procedure. So a lot of things factored. It wasn't the surgery itself, but the staff and the procedures afterwards.
Well, the report really zones in on the lapses in certain things. Like you said, rescue equipment was one of them, and then resuscitation training, they noticed.
Yes, so some of the equipment was expired. It hadn't received its proper annual certification, and then as well the resuscitation training. Now, nurses and doctors at these outpatient facilities, they do have the same education and training and certifications as nurses and doctors in the hospitals. However, by virtue of just sheer practice, hospital, they're accustomed to dealing with complications. They have code blue teams, people specially designed to handle these complications. In an outpatient surgery center, you just don't have that. And when there are complications, they call 911. And so just imagine, you call 911, there's time. Time is tissue. And it makes a big difference in whether someone is able to survive a surgery or not.
Wow. You suggested several questions that patients should ask if they're considering a surgery center, and one of them is talking to the surgeon or the physician about their connection to the center, why they're recommending you to this place.
Right, and the reason being is because there aren't any stark or kickback laws when it comes to these ambulatory surgery centers. So a physician can very well own outright or partially own these facilities. So not only do they make their money performing the procedure, but also the facility costs. So not saying that physicians, would purposely look for financial gain, but it is very lucrative for a physician to refer their patients to their ambulatory center versus a hospital. And so that's just something patients need to ask their physician. Are you personally connected to this facility? How?
Anything else that people should know that are considering going to an outpatient surgery center?
Absolutely. So you'll want to ask your provider, am I healthy enough to have my surgery at an ambulatory center? Some people, by virtue of having other health conditions or some very unique anatomy, need to have their surgery at a hospital so they can have overnight care. As well, you'll want to know, what is the backup plan? If something goes wrong, what happens next? How far am I from the local hospital? So who's going to take care of me in that situation? And also, how many surgeries like this have you done at this facility? What's your track record? And also, what's the facility's track record at these outpatient surgery centers?
Wow, really good information. Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for coming in.
Yeah, thank you. Good to see you.
Thanks.